Okay, so what are your options when it comes to testosterone therapy? You're probably going to be real familiar with seeing that most people tend to opt for injectable therapy when it comes to testosterone. There are many reasons for this. The two most common are going to be it is certainly cheaper. And it's also the more traditional, the more well-studied whenever you're looking at the actual data and everything. It has, decades more of research and whatnot rather than the other forms, which would be typically gels or patches. Gels and patches tend to be pretty cost prohibitive. Insurance companies are not a fan of covering them, even for cisgender dudes. So with regard to those, without some kind of major heaven sent intervention, you're probably not going to be getting on patches for sure, because those suckers cost anywhere from $200 to $500 a month. And then the gels, the most recent cheapest gel that I found was the Androgel generic. And with a good RX coupon, the Androgel generic, for a 1 month supply of one type of dose, keep that in mind. It's not like you could change your dose up or down and have the same price. It's only one type of dose, and that is the lowest of the normal starting doses, 2 pumps a day. The price of that is somewhere between $60 and $100 a month, which is still pretty costly for a lot of folks. So that one is basically going to be up to the person. I don't really have a preference over how people do their testosterone therapy, whether it be injectable through intramuscular injections, subcutaneous injections, or patches or gels. It's just that, patches and gels tend to be a little bit cost prohibitive. But hey, if you are independently wealthy, you go right on ahead and tell me that is what you want. Doesn't bother me at all, again. So are there major differences between them? Not particularly, although I did mention before, there's not a lot of data out there on the efficacy of like transitional effects of patches and gels. I mean, there's, enough research out there on cisgender men and how they're affected, but not really a whole heck of a lot as of yet on those who are transitioning toward the masculine end of the spectrum. So there is that to be considered. It does seem to get people's levels up to, similar and good enough, testosterone levels as compared to injectables. And there can be some benefits to patches and or gels in that, they are applied generally, well, the gels are applied daily, and so your levels don't, go so high and so low as they can on, say, weekly injections of testosterone. And then with patches would be kind of nice if they were affordable, because they release a nice steady stream of testosterone into the bloodstream, and so you don't have to worry about those ups and downs really much at all. With patches and gels, though, you do have to be concerned about transference to other individuals who may not be such a fan of waking up, one day with a mustache or something like that. That could be quite detrimental to your relationship with them, in fact. So with patches, you got to keep it, in a place where it's not going to rub on someone, and be sure that it's not going to fall off in bed and get stuck on their back or something. But anyway, and then with gels, most gels in general, they're going to have some slight differences or whatever. Most gels, the most of the testosterone will have absorbed into your system after about 2 hours. But up to 6 hours or so after application, you can still have a little bit of transference of testosterone that is still kind of on top of the skin to someone else. So that is a definite consideration whenever you're considering doing a gel or other topical testosterone. So then going back over to injectables, of course, they don't transfer to other people, which is quite nice. They're generally given, starting off, at least at my clinic, at weekly injections. It kind of depends on the person, what other issues you might have going on. Just for example, if you have bipolar disorder, it might be more beneficial for you to do microdosing, which is where you take smaller doses of testosterone spread out over the week, 2 or 3 times a week rather than once a week or whatever. This helps you not have such high peaks and troughs. So, instead of once a week dosing where your testosterone levels skyrocket up and then kind of bottom out, you do several times a week, and so you just kind of go up and down just a little bit, and that way you don't have such high peaks and low troughs, which could potentially, trigger the mood swings that are characteristics of puberty, but can be quite a bit more annoying for those who are suffering from bipolar disorder. But as you see while I'm talking about it, bipolar disorder is not a contraindication to being on testosterone therapy, so get that right out of your head. It just means that we have to be more aware of how we proceed and everything like that. You can also opt for once every other week injections and or once every 10 days injections. Kind of depends on how your levels go, how you're feeling, and at what point you're at in your transitional status. So I don't recommend doing every other week injections until you are, a few years into your transition, just because most people, like 85–90% of people, are not going to keep their testosterone levels up high enough that second week to really get the most effect transition-wise from testosterone that they're taking. So it's like 1 week you have, yay, really nice testosterone levels. Second week it's just kind of like, bleh, you're just maintaining, which is great if you've already gotten a lot of the major changes and effects that this has, benefited you. But if you're still wanting those effects, then it's not going to be that great of a choice, because again, you'll have good effects that 1 week, but then you're just kind of maintaining the second week. So I don't know, not the best choice in my opinion. I generally start people out once a week, and then as we go along, we recheck your labs and we see where they're at. We'll see if you maybe could squeeze up to, every 10 days if your lowest level that we check shows that you're staying up at a pretty decent rate, so that you could stretch it a little further, save yourself a poke here and there. And then, like I said, if it's having effects on you to where you're just like, woo, I'm losing my mind, mental changes or whatever, nah, that's not really something that happens with testosterone. It's just mood swings from this second puberty you're going to be going through. Don't let people fool you with these myths of people just, being super angry and aggressive on tea. Maybe they are if they're self-dosing and they don't know what they're doing. But with the way we do it, you're not going to be doing that. You just have some mood swings that are annoying. I won't deny that, but you're not going to be, chewing through a wall or something like that. Anyways, so those are the basic offerings of testosterone, be it either subcutaneous or intramuscular injection of testosterone. You can check out what the difference between those two are with other videos that I have put out. And then there's the gels and the patches, which, like I said, they usually cost a little bit much. And might be like that androgel might be an okay choice for someone who's going for more like non-binary results, because then they won't have to use as much. And so that 1 month supply that costs $60 to $100 might last them 2 months. And then it's not so bad. And I guess I should have mentioned at the beginning that injectable testosterone with a good RX coupon compared to patches and gels, it usually is going to run you on average somewhere between $50 and $100 or so for a vial that's going to last you, a 90-day supply, something like that. There are a lot of variations to that depending on where you live and what the coupon situation is and blah, 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 and all that. But in general, I'd say an average maybe of like $80 for a vial, something like that, or, a 90-day supply. Anyway, so keep all that in mind. If you have any questions or anything, you can always contact me and ask me. If it's something I don't know, I'm going to go research it and let you know. And if it's something that I get asked over and over, I'm going to put out one more of these annoying videos. So, all right, catch y'all later. Bye.